We've got Kristi Cashman, who's my non-invasive body contouring expert. I'm Dr. Melanie Palm, here at Art of Skin MD's Body Suite here in Solana Beach. And yesterday I posted a photo of some results using Emface.
They're so fabulous.
For that patient in the submentum, so the area we call kind of the double chin, the area of the cheek we used on her. And today we thought we would run through, you can see we've already got one of the applicators of Emface on my cheek, but we're going to put the other one on the cheek and put one on the forehead, and I've got almost a 5 head, so it's a very easy fit. We can talk about how the fact that we now have 2 applicators, there's a small one for small foreheads and a large one for people that have more generous foreheads like myself and Aman. And then maybe we'll walk through, I won't talk for a second, Kristi.
Oh, you're good.
But maybe let's talk about placement of Emface first, and then we can kind of talk about the technology. So when you're seeing someone, you know, we've got 3 areas we can treat. What are those 3 areas?
So we can treat your forehead, your cheeks, and your submentum. And basically those are all areas where we have elevator muscles, or muscles that lift the face. So when a patient comes in for their consultation, we assess and just take a look at, first of all, we ask what's bothering them initially, and then assess where we could make some little improvements. On the face and forehead, basically what we're doing is increasing muscle tone and increasing collagen and elastin production, reducing wrinkles. But under the chin, we're actually also able to now remove a little bit of the subcutaneous fatty tissue. So if somebody comes in with a little double chin, then we can actually use the submental applicator to help with the muscle, the fat, and the skin in that area.
Amazing. And then I'll let you hook me up and we'll get started, and we'll obviously talk quite a bit more about the technology and what it can do. So you already off camera, we've cleaned my face, and then we did a double alcohol rinse because with these applicators, they're like sticky notes, you know, so, and we want to make sure there's not natural body oils residue on our face, you know, either makeup or just what, you know, the sebum that our body produces, so that we get excellent adherence, because if there isn't good contact with the skin, there's safety measures in place with Emface, including this guy, which is the safety abort button.
Just in case button.
For me. It won't operate appropriately. And so we'll talk a little bit about it, but did you need me to touch? I'm going to touch, so I'm good to go, and then you're going to get things going. It's a very easy interface to understand.
So, very user-friendly.
You're selecting which areas we're treating.
Exactly, so we've got it lit up here where we're treating the forehead and the cheeks, and we have the ability to treat each side differently. So if a patient has asymmetries, I can adjust for that, or if a patient feels like there's a muscle that's much more reactive on one side, I can adjust for that. So it's really, really a nice...
We can kind of tailor treatment, bespoke treatment. So, you know, we've had several patients, particularly with like forehead treatment, they've got one brow that sits a little bit lower. If it's not levator dysfunction, which means, you know, it leads to brow ptosis and eyelid ptosis, or I should say eyelid ptosis. But if it's true brow ptosis and there's just a slight asymmetry, we've had patients where we dial up a little bit more of the high-fest technology, the high-intensity focused electrical stimulation. That's the muscle sort of stimulating portion of the device, and try and work on that one side that is a little bit lower brow position.
Yeah, we've had really good luck with it, actually. Really nice.
And then how do you, so right now I feel on my forehead, I explain to patients I've had talks, but I'm probably 3 or 4 months out from the last time I've done a neuromodulator.
Which is perfect for this, actually.
Yes, so if we can catch people, it's not an absolute, but if we can catch people near the cycle where they're natoring, where they're getting near the bottom before we're sort of re-upping their toxin, I think that's a nice opportunity to catch them, because we're trying to bulk up the tissue a little bit. We're trying to get that nice, juicy, healthy muscle bulk that we had when we were younger. And, you know, so I like to be able to capture as much muscle movement as we can. You know, there hasn't been a study to show whether that makes a difference, but if we can capture people, that's a great opportunity to do it. But if you have had tox, I think you don't feel as much of the frontalis actually contracting. The frontalis is our forehead muscle. It acts as an accordion, so the upper third of it above this, what we call a line of conjunction, or line of convergence, I should say, it brings our hairline down, like the accordion. The lower 2/3 of it, its job is to bring the eyebrows up.
Nice.
So if we are contracting that, we're helping to raise the brow a little bit, build some bulk in that area, and then the radio frequency portion, which we'll explain with Emface, it helps build some collagen, build some elastin, so it helps with some of the static forehead lines and a little bit of skin texture. But we want to be able to tone that muscle, help with tissue bulk. You know, we think about the accordion-like action when we're doing neuromodulator because we primarily treat in the upper third of the forehead. We don't want to play too much in those lower 2/3 because that's really what determines sort of brow position, and especially in patients that use their forehead muscle to maintain brow position, we can't. That's like a no-fly zone. We're going to drop their brows. So this is a really nice treatment option in addition to Ultherapy, which is an ultrasound-based technology that we do to lift brows. I think that can be kind of a 1-2 punch. Sometimes I'll do fillers in areas to help with that as well. But how long is treatment typically?
So treatments are typically 20 minutes, super easy. You come in usually once a week. You can come in as often as twice a week if we want to get it, just get it done. But my average patient comes in once a week, and depending on the patient, again, we just assess for each patient, and it could be anywhere from 4 to 6 treatments.
Yeah.
So I would say my average patient does 6 at this point, because we just get fantastic results with that.
And the clinical studies, which patients were treated, subjects were treated once a week, 4 times.
Right.
We saw on average, and this is done with objective measures, a 30% muscle mass uptake, and then lift percentage, so actual lift in the face when we compared baseline photos to after photos, that percentage was in the like a 26-27% lift. Increases in collagen, about 26% increase in collagen production, doubled the amount of elastin fibers that were seen in tissue biopsies. And we're really, in the treatment I'm receiving today, forehead, we're treating the frontalis muscle. That's our big, broad forehead muscle that tends to kind of bifurcate, or it separates almost like a V in our forehead. In the cheeks, we're targeting 3 muscles. So all 3 of them start at the corner of our mouth, a fancy term we call the oral commissure. And 2 of them are zygomaticus major and minor muscles. They go from the corner of our mouth up to the apex of our cheek, and they help us smile. And then the other muscle is our risorius muscle. And so it goes from the corner of our mouth into kind of the mid-cheek region as well. And we're trying to tone those because they are like hammocks that hold in some of our soft tissue. And there's, we've talked about on prior sort of lunch and learns, we're doing more an afternoon tea, I guess, with this one, although it's almost dark in California right now, even though it's late afternoon, that we undergo sarcopenia. So starting in our 3rd and 4th decade, unless we are just supremely keeping up with things and really just doing a ton of muscle training, keeping up with our protein intake, we start to lose muscle mass over time. And that's not just on our body, it's on our face. So our muscles go from being juicy and dense to becoming a little more sinewy and becoming a little more thinned out. So we want to do things to maintain muscle bulk because it helps with resting tone of our muscle. So I love this because I think, we do a lot of structural injectable work here, but thoughtful.
Yes.
And I think in lower thirds of the faces, especially with women, we don't want to widen faces.
Absolutely.
There's volume loss, but we don't ever want to add too much bulk and masculinize a face. And we want to give those pretty sort of vectors of lift back.
Exactly.
So I think this has been a real godsend for us.
Oh my gosh, it's been amazing.
Super popular. I mean, props to us, and Kristi has been doing Emface since we got the device for the past couple of years. We've now got Ricky on Select Fridays too, and she's really adept at this procedure too. But we are doing roughly 3 to 4 times more than most California average practices here, and nationwide I think much higher as well. And so I love that because I feel like we can be a real center for expertise. My interest is in clinical research, so I think hopefully you'll see things coming out in the future where we've been involved with things and we can talk about things, interesting ways of treating it. But for right now, we've got 3 FDA approved areas, or cleared, I should say. So forehead, we're doing cheeks, and then submentum. So when we're treating submentum, like Kristi mentioned, we can muscle tone.
Yep.
But we can also help with skin texture a little bit with the heat from the radio frequency, the monopolar radio frequency. And if people have fat that we want to treat,
Yes.
we can adjust the settings a little bit to drive the heat a little bit further to also cause apoptosis of the fat cells as well, which is controlled cell death.
Yes.
Now, in the chin area, we're treating a muscle called our digastric muscle, and it's got kind of almost like a V shape, and there's a digastric muscle on either side, and it's kind of like the floor of our mouth.
Right.
And what we call the submental area. And if it gets more lax over time, we lose this beautiful angle called our cervical mental angle, which ideally we want kind of around 90 degrees. And so if you guys look at our Instagram page,
Yes.
Dr. Melanie Palm, and I know you posted it on our Body by Art of Skin page as well, you see a real improvement in this transition from the chin to the neck.
Absolutely. Yeah.
And I think you would look at some patients and her before and say, is she a surgical candidate?
Right.
And we have a lot of patients that are either just not ready for surgery yet, have no desire to do that, would like to do something that is not painful.
Yep.
They can come in here for a small series of treatments with you. You can see I'm doing this. I'm not in pain. I'm not in discomfort. We have a TV right behind us, so most patients are watching something comfortably on TV. Or just, enjoy your time, the 20 minutes that we have, and receive a treatment.
Relax for a few minutes. What was I just going to say? The submental
area, was something sort of focused on that?
It was, no, I was going to say something about our before and afters. If you go again to either our website and or our Instagram pages, you can see our before and afters. In addition to the one that we just posted yesterday, there's several. There's men, there's women of all ages. The youngest I've treated, I think, is in her lower 30s. The oldest I've treated is in her upper 70s. So this is good for, I know what I was going to say, this is good for everybody. And everybody who wants sort of a natural look, or to increase their body's natural ability to.
Yeah, and I think my general approach to patients when they come in for an aesthetic consult is like, how do we harness your body's own ability to heal itself and renew itself? And we have not had something short of surgery to address the muscle compartment to lift or bulk it. We've had ways of relaxing muscles where they're causing unwanted wrinkles, and that's what neuromodulators such as Botox, Dysport, Jeuveau, Daxify, whatever, pick your Xeomin, choose your poison, with a wink, pun intended for sure. But we have not had ways to really harness our muscles' ability to perform well in the face and do that non-surgically. So I really love that. We have ways of rejuvenating the skin envelope and getting the collagen and the elastin to behave in a more youthful manner. We have ways of supporting some of the soft tissue loss that we have over time. So now it's really amazing to have something in our clinic that we can use non-surgically to help this. And if patients are considering surgery down the road, this isn't something that a facial plastic surgeon or plastic surgeon is going to be upset about us doing. I tell them it's almost like physical therapy for the face.
Exactly, it's like pre-rejuvenation or prehab instead of so you're getting those muscles ready for and the collagen and the elastin ready for good healing after surgery.
And I think after surgery,
boy,
those patients maintain results, and I think this can be part of your post-surgical, what we call rhinopectomy when we're doing a facelift, sort of paradigm to maintain those results and be able to attenuate them over time. So, I'll tell you, it's one of those things that when you look at before and afters, people just look beautiful, more handsome,
just more youthful,
and it's just a global change.
It is.
And I love that. I love things that people look more attractive, more like their more youthful self. We're sort of restoring that, but you can't put your finger on it.
Exactly. They don't look different. They just look better.
And the reason we're talking about this is this month you are running a special, as is Ricky, over here on the Body Suite site. So tell us a little bit about that.
So we're doing a Give Yourself the Gift of Lift. And we're doing 15% off for the month of November of any Emface package. So either 1, 2, or 3 areas. You can mix and match however you like. But 15% off the entire package. So that's a nice little savings. It can be up to, for a package of 6, for 3 areas, I think it's about $1,600 off. So it can be a nice little chunk.
Yeah, so that I think
really
that's
helpful.
fantastic. And you know, I'll tell you, before we had a submental applicator, we had a lot of patients doing full face, which at the time was forehead and the mid face.
Right.
And as soon as we had the submental, you had a lot of your in-face patients coming back to do that third area.
Absolutely.
And now we have people in maintenance. So I think I've been pretty consistent. About once a quarter, you'll do a maintenance treatment on me. We know from studies on the body, with slightly different technology, that we have pretty enduring results. It probably, you know, you're probably maintaining results for 6 to 12 months, but just like you wouldn't stop going to the gym if you attain your goals. I think maintenance is really the key to looking great over time. We say that with skincare, we say that with laser treatments, we say that with thoughtfully done injectable work, and I think it's the same here. So, you know, not too long ago, we did a little maintenance treatment with Sculpt on my abdomen, getting ready for fall sports, my yoga game, I gotta get on my plane. Well, it was time to do this, and I'll tell you, when this first came out and you did the initial series of 4 on me, and then I was lecturing on stage for one of our live injectable sessions at our annual Academy of Dermatology meeting. A lot of my friends backstage who are phenomenal injectors, dermatologists, plastic surgeons all over the country, and in some cases even out of the country, and they know me well, and they're like, what are you doing differently, Melanie? Like, you look fantastic. And the only thing that had changed was Emface. And I really, you know, I do a fair amount of stuff that ends up on camera, and you would see, you know, mid-40s, like something a little jello-y was happening along the jawline, or with animation, talking, that sort of thing. And I feel like it's really improved that.
Absolutely.
So when people notice that, and especially really discriminating eyes, people that for a living like me are evaluating faces to really sort of keep patients at their best, I take that as the highest compliment. And I love this technology. I've just seen it executed so well even on my own face.
Absolutely.
And in so many of our patients.
Well, what patients can expect from this, I like to kind of
set
give you a little,
expectations, and we like to under-promise and over-deliver.
Yes, so it's not going to be, you know, surgical results, but what a lot of people have been seeing is a nice sharpening of the jawline, a softening of the nasolabial folds. With the lift of the cheek, a lot of times you get some more fullness in this area, so the hollows under the eyes don't look as prominent. Softening of the forehead lines, and then the forehead is beautiful. You get a little lift right in the center and a lift to the lateral brow.
So you've even seen sometimes the crease in the upper eyelid.
Absolutely, that happened on me actually. I got a nice little lift there. And then under the chin here, you'll see a reduction in volume, and then sort of that also helps to sharpen the jawline, and then actually even pull the neck up a little bit. I've seen a lift in the lower neck just from this muscle.
Is this
lifting
100%?
No, I didn't want you to be making faces if you didn't want to.
No, I definitely want to crank it up, girl.
All right, you got
I was
it.
like, this seems so mild. No, I don't mind. I'll wink on the camera. That doesn't bother me. So, you know, we usually get patients up pretty quickly to that, and as you can see, this is treatment, and I think it's really, you know, you'll see me like, sometimes my left side's a little different than my right, so we recruit a little bit of my orbicularis, which I actually don't mind sort of building up that area. But it feels like you're just involuntarily, obviously, contracting the muscle, and you feel a little bit of gentle warmth, but it's not something that hurts.
I've had patients fall asleep. Most of the patients who come in, just the first treatment is a little bit, you know,
weird because you don't know what to expect.
So patients giggle through the first one, and then by the second one, they're set, and they just kind of relax for 20 minutes. It's really nice.
Yeah, no, I think it's one of those things that you're like, how could this possibly be this tolerable? And I personally believe easy as a patient to tolerate, and that you sort of see a change, and I think it's just blown me away in the last couple of years, sort of what what we've seen out of patient results, what I feel like I've personally seen in my own face.
Oh my gosh.
And it's something,
It's every time I see my before and
Yeah.
afters, I'm just so excited for the person. It's just so pretty.
And then afterwards, little pinkness on the face
Right.
is certainly popular, or possible, I should say.
Right.
That
Warmth.
subsides.
Yeah, in about 20 minutes.
Yeah.
I always put a little bit of product on patients afterwards so you don't go out, barefaced. Want to make sure we get your sunscreen on. And I also, there's a couple products that I recommend along with this. But yeah, you can go right back to work, you can go out and do errands, nobody will know anything was done.
Question we get asked sometimes is if people are struggling with melasma, if the heat is going to stimulate that. I mean, I do have melasma. I haven't noticed that mine has been sort of reignited. It's certainly a discussion. I think if we have somebody with poorly controlled melasma, this wouldn't be the first thing that I would offer to them. We would want to make sure that we're managing that with topical therapy and appropriate measures before we consider this. And there's always the option of turning down the radio frequency, which is what generates the heat. I have a grounding pad, so we're using monopolar radio frequency, so it means technically the electricity is kind of circulating through from the ground, or from grounding pad and here, so we want to make sure that there's no major metal appliance. So if you do have a major
maker or something like that,
not going to be your treatment choice for you. We obviously don't do this on pregnant women, women that are nursing. There are contraindications that we would discuss at your consultation.
Exactly. We take a thorough medical history, so we want to make
With this being as experienced as you and Ricky are, we are so fortunate to extend to patients a complimentary consultation.
Yes.
So if you are interested in just learning about it, seeing some of the before and afters, discussing the special that we have going on this month, you certainly can call us. I mean, our offices are closing soon today, but you can put that on your list for tomorrow's tasks. And if you're interested in talking to Kristi or Ricky, they certainly are available to do that. And I think it's a nice time to think about it. Be your own stocking stuffer.
Yes, exactly. Take some time for self-care in the holiday season.
So anything else, just in conclusion, that you wanted to kind of talk about? We've talked about maintenance, the therapy itself, what it feels like.
Did we talk about how often to do? Oh, I guess we did. It does take maintenance. So about every 3 to 6 months, I have patients come back for maintenance. Just one treatment, just to keep the muscles toned.
Yeah, and I'm now almost 2 years into that maintenance phase and really like it.
Yeah.
So I think it's a great technology, very innovative. We just don't have anything like this that's addressed muscle toning in the face. And I think something that's just such a lovely multimodal approach to so many of our patients that we've got them on good skincare. We're doing things to help with the skin envelope. We're supporting them structurally, and this is something that we can non-surgically create a lift. Yeah. Well, with that, if you got questions, you can certainly, we've got a little search bar on our website, so if you go to artofskinmd.com, you can type in Emface, which is EMFACE, and you can find oodles of information based off of the clinical studies and the results that led to FDA clearance. And if you are interested in booking an appointment with Kristi or with Ricky and talking more about Emface in these 3 areas that we can treat, certainly give us a call. It's 858-792-7546, or on our website. You can certainly write us a little email and we will contact you as well. But I want to wish everybody, since we're close to it, a lovely Turkey Day. Safe travels, and that's perfect timing. Done with our 20 minutes, so we will spare everybody more blabbing from Dr. Palm. But I want to thank you for your time, Kristi, and all of your experience as well. And with that, our old-fashioned way, we are going to turn off our live and wish you guys a good evening. Bye, everyone.
And